And this morning we continue with this relationship that we have formed with the Foundation for Community Health here at Robin Hood Radio, where we focus in on what the Foundation for Community Health is all about, what they do for our area, what they've been doing for our area, and we also bring into the fold some of the people that they help that are basically nonprofits in our area that otherwise certain programs wouldn't even get off the ground in our area. So this is why we've come together with the Foundation for the Community Health for these interviews. And today our interview is with Elizabeth Spira. Elizabeth is the Chief Executive Officer of the Community Action Partnership for Dutchess County. And we welcome her to Robin Hood Radio. Good morning, Liz. How are you?
Good morning. I am well. And good morning to all your listeners as well.
Well, let's talk a little bit, first of all, and explain a little bit what the Community Action Partnership in Dutchess County is all about.
Community Action Partnership was formed in 1965 to fight the war on poverty, and here we are so many years later, still fighting that fight. We provide services and programs to help low-income individuals and families meet their economic needs, meet their crises, and then help them improve on their circumstances, can help them reach out for training in new areas or making better connections and budgeting, and et cetera. But just about anything that will help them economically is something that we have under our umbrella or would like to have under our umbrella.
All right, so now looking over the notes that I received from the Foundation for Community Health, so let's talk a little bit about your prescription assistance program, when it was established and what it's all about, because this is one of the major things. We see it on TV now all the time with these different apps now honing in on helping people pay less. But really, the main thing about our health care isn't the quality of our health care, it's the access to it. Let's talk about your prescription assistance program. How was it established, and what exactly, how does it function?
The prescription assistance program has been with Community Action for as long as I've been with Community Action. It will help families pay for their prescriptions if they're uninsured. It will also help them pay for copays on prescriptions. And it has a very generous income eligibility guideline, so it really is reaching out to try to help anybody in need. So families can connect with their pharmacy, connect with us, and between the two, we'll get their prescriptions paid for.
Is this something they apply for, just in general before they do anything, so they're like approved by you?
They come in and we do a screening at the beginning of the year, every year, for anybody who has participated in the program. And new people, should they come into the agency looking for assistance, sometimes it's assistance in some other area, but when we sort of go through what's going on with them, we find out that they're also struggling to meet their prescription costs, and we'll do an intake then. The income guidelines are very generous. We're increased to 400% of the federal poverty guideline. So anybody who's struggling to meet those is pretty much eligible for this assistance program.
You know,
they live in the Northeast Dutchess region, though. I want to point that out.
Yeah.
Serves the communities in the Northeast.
Okay, so it's for the communities in Dutchess County, Northeast Dutchess County. What's so interesting about the program that you offer is that I sit here at 68 years of age, and when we started this broadcast facility 10 or 12 years ago, I had no insurance. I had been dropped by my carrier, and I had no insurance, and I went without insurance for about 3.5 years, which was a frightening time. I finally, through the Affordable Care Act, got insurance, and now with Medicare, I'm fully covered. But this is an important thing in communities, not only for people's health, what you offer, but if people are healthy, they can get out and work, and they can do more in the community.
Yes, exactly. And medications are such a integral part of everyone's health. You can't concentrate, you can't work, you can't focus if you're worried about whether or not you have enough money to buy your insulin or your blood pressure medication. It's very important that you're able to meet these needs.
And so let's talk now a little bit about the prescription assistance program and the Foundation for Community Health, how they're involved and how they're helped, how their help helped you put this program together.
Well, as I said, it has been with the agency for as long as I have been with the agency, so I'm not sure who approached who, but they are our funder for this program in the Northeast Dutchess region, and every year we renew and go on doing what we're doing. I think we serve 5 people in a year, but we also, with their funding, we're able to pay for around $3,800 worth of prescriptions every month. So it's the prescriptions, or it's the co-pays, or recently have added to reimburse for the Medicaid Part D. So very, very generous program.
What's so great about this is when you look at what goes on. A lot of people know about the Foundation for Community Health. They remember when it was formed. But the great thing about this partnership that we have with them and talking with people like you is now you really see how the Foundation for Community Health impacts the region and impacts various nonprofits in the region that are around to help people, not necessarily by doing program work, but by offering the assistance to get the program not only off the ground, but keep it funded. I mean, It would be devastating if this program for the people in Dutchess County, if this program were not around.
Yes, it would be.
So now
it's very clear every month when we, kind of tally things up and look at who's been served. It's very clear that this is a very important program.
Well, let's get back for a second here, Liz, and take a look at as you as CEO and how things have changed since you've been around and with the Community Action Partnership. Are things better? Are things marginally better, or a whole lot better, or are you a little worried about the future?
Well, I'm very worried about the future. I think things have changed, but it hasn't necessarily improved for many of our low-income families as costs have gone up, but income has not. A lot of the families we serve in the program are fixed income or are retirees, and their funds are never going to go up, and the costs continue to rise. So it's a little scary for many of the people that we serve. I don't see, while we do have an increase coming for the minimum wage, it's really not enough of an increase for them to afford to live in Dutchess County. There's a much higher cost of living than that, and many of the jobs that are available are entry level, so they will start at minimum wage.
And when it comes to paying for health care, whether it's prescriptions or whether it's the health care itself, even if you have if you have help and coverage, it's a pretty sophisticated thing, and people need help. And obviously, organizations like yours, a Community Action Partnership in Dutchess County, helps people. It probably takes away some of the nightmares they might have about getting involved in finding out how they pay for their health care.
Exactly, and if you can take this off of their worry level, goes way down, and they can focus better on the other things that need attention in their lives.
You have a talking point here. Community Action Partnership for Dutchess County receive funds from different funders to help individuals and families get the prescriptions they need. It's a pretty broad-based effort and support from various members, not only the Foundation for Community Health.
Yes, we do have some other funds that contribute to prescription assistance. This is the primary one serving the Northeast Dutchess region, and other funds can maybe focus on other areas of Dutchess County. So yes, we have a lot of contributors to help with the rising costs of health care and others. We have funding to help with rents and utilities, and prescriptions is just one part of a family's budget that's difficult to meet.
And by listening to Elizabeth speak this morning, you understand how now important the foundation is, because not only do they help the Community Action Partnership for Dutchess County, but so many other agencies. I think right now in this series, I think we've spoken to 20 different agencies right now that wouldn't have certain programs running if it weren't for the yearly or even the startup help from the foundation. So you've got a very busy job there. I hope some of the you must have some days where you just shake your head and say, how is this all going to shake out? But I think the more the community gets together and the more people understand about programs like yours, the better things will be.
Yes, I think so as well. We need to communicate with each other and be available to help when help is needed.
Elizabeth Spira from the Community Action Partnership from Dutchess County, thanks for joining us this morning.
Well, thanks for inviting me.
All right, take care.
Take care. Bye-bye.
Once again, part of the Foundation for Community Health, this program, they just do an outstanding job. All right.